Nurse Aide State Exam. Question 1. The nurse aide notices a spill on the floor. The nurse aide should: Option A, walk past it. Option B, place a sign and clean it immediately. Option C, wait for housekeeping. Option D, call a family member to clean it. The correct answer is option B, place a sign and clean it immediately. Question 2. The nurse aide's primary role is to: Option A, diagnose illnesses. Option B, administer medications. Option C, provide safe, quality personal care and assist with ADLS. Option D, create treatment plans. The correct answer is option C, provide safe, quality personal care and assist with ADLS. Question 3. The correct sequence for removing, doffing, PPE is: Option A, gown, goggles, mask, gloves. Option B, gloves, goggles, gown, mask. Option C, mask, gloves, gown, goggles. Option D, gloves, gown, goggles, mask. The correct answer is option B, gloves, goggles, gown, mask. Question 4. When positioning a resident in bed, the nurse aide should use: Option A, pillows only for the head. Option B, supportive devices like pillows and wedges as needed for proper alignment. Option C, restraints to hold the position. Option D, the same position for all residents. The correct answer is option B, supportive devices like pillows and wedges as needed for proper alignment. Question 5. A nurse aide who is unsure how to perform a delegated task should: Option A, attempt the task anyway. Option B, refuse the task without explanation. Option C, ask the nurse for instruction or clarification. Option D, ask another aide to do it. The correct answer is option C, ask the nurse for instruction or clarification. Question 6. A resident is at risk for pressure ulcers. The nurse aide should reposition the resident at least every: Option A, 4 hours. Option B, 2 hours. Option C, 8 hours. Option D, once per shift. The correct answer is option B, 2 hours. Question 7. Which of the following promotes independence for a resident with Parkinson's disease during meals? Option A, feeding the resident completely. Option B, using adaptive equipment such as weighted utensils. Option C, rushing the resident through the meal. Option D, serving only pureed foods. The correct answer is option B, using adaptive equipment such as weighted utensils. Question 8. When a resident is dying, the nurse aide's role includes: Option A, avoiding the resident. Option B, providing comfort, pain reporting, and emotional support to family. Option C, telling the family to leave the room. Option D, keeping the room brightly lit at all times. The correct answer is option B, providing comfort, pain reporting, and emotional support to family. Question 9. The nurse aide receives a request from a resident's family member to review the resident's chart. The nurse aide should: Option A, share the chart with the family. Option B, tell the family member to ask the nurse or administrator. Option C, read the chart to the family member. Option D, leave the chart open for the family to read. The correct answer is option B, tell the family member to ask the nurse or administrator. Question 10. The nurse aide enters a resident's room and finds the resident unresponsive. The nurse aide should first: Option A, run to find the nurse. Option B, tap the resident, call their name, and if no response, call for help while staying with the resident. Option C, leave the resident to call 911. Option D, begin CPR without checking for responsiveness. The correct answer is option B, tap the resident, call their name, and if no response, call for help while staying with the resident. Question 11. The most effective way to promote a resident's dignity is to: Option A, do everything for the resident. Option B, make decisions for the resident. Option C, encourage independence and respect privacy. Option D, discuss the resident's condition with other residents. The correct answer is option C, encourage independence and respect privacy. Question 12. A resident who has had a stroke affecting the left side should be taught to: Option A, ignore the left side. Option B, use only the right side. Option C, include the affected side in activities and use adaptive techniques. Option D, wait for the left side to recover completely before any activity. The correct answer is option C, include the affected side in activities and use adaptive techniques. Question 13. Which of the following is not included in a resident's intake and output, INO, measurement? Option A, 4 fluids. Option B, urine. Option C, emesis, vomit. Option D, sweat. The correct answer is option D, sweat. Question 14. A resident has an order for intake and output. What should the nurse aide measure as output? Option A, 4 fluids. Option B, urine, vomit, and liquid stool. Option C, solid food consumed. Option D, ice cream eaten. The correct answer is option B, urine, vomit, and liquid stool. Question 15. A resident's dentures should be stored in option A, hot water. Option B, a dry denture cup. Option C, cool water in a labeled denture cup. Option D, wrapped in a paper towel. The correct answer is option C, cool water in a labeled denture cup. Question 16. A resident is experiencing a seizure. The nurse aide should: option A, restrain the resident firmly. Option B, place something in the resident's mouth. Option C, move objects away and protect the resident's head. Option D, pour water on the resident's face. The correct answer is option C, move objects away and protect the resident's head. Question 17. A resident is in the prone position. This means the resident is: option A, lying on their back. Option B, lying on their stomach. Option C, sitting up at a 45-degree angle. Option D, lying on their side. The correct answer is option B, lying on their stomach. Question 18. The normal adult pulse rate range is: option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 100 to 140 beats per minute. Option D, 120 to 160 beats per minute. The correct answer is option B, 60 to 100 beats per minute. Question 19. A resident is having a diabetic reaction, hypoglycemia, and is conscious. The nurse aide should: option A, give the resident insulin. Option B, give the resident a sugar source like juice and report to the nurse. Option C, withhold all food. Option D, have the resident lie flat. The correct answer is option B, give the resident a sugar source like juice and report to the nurse. Question 20. When providing oral care to an unconscious resident, the nurse aide should position the resident: option A, flat on their back. Option B, in a side-lying position. Option C, in a sitting position. Option D, in Trendelenburg position. The correct answer is option B, in a side-lying position.